Hello everyone, my name is Lisa Cosley and I'm a fellow classmate in Public Health 2270. I'm here to present my global health project, Cardiovascular Disease in the Bolivarian Republic of Venezuela. I hope that this presentation is informative and assists you in understanding how influences outside of one's own personal control can and will affect your health. Thank you and enjoy. Non-communicable diseases, also known as NCDs for short, are the primary cause of death around the world, accounting for 74% of all fatalities. Obesity, high blood pressure, increased blood sugar levels, and high cholesterol levels increase the risk of NCDs. The most common NCD is cardiovascular disease. It is attributed to the deaths of an estimated 18.6 million people every year. In Venezuela, cardiovascular disease is a significant public health issue and is responsible for 35% of all deaths. Venezuela, officially the Bolivarian Republic of Venezuela, is a country on the northern coast of South America, consisting of a continental landmass and many islands and islets in the Caribbean Sea. Venezuela comprises an area of 916,445 kilometers squared, and its population was estimated at 29 million in 2022. Okay. Unfortunately, the government's failure to prioritize health care, reduction in money allotted for universal health care initiatives, and the continued acts of corruption helped to advance the harmful health outcomes for Venezuelans. A retreat from democratic policies dissolved the freedoms of the press and civil rights, furthering governmental levels of corruption. The unrest forced many healthcare workers to leave the country. The policies of the Chavez regime forced Venezuela to rely on imported goods, which led to major shortages during the first decade of the 2000s. His policies affected the means of receiving appropriate medical care. Economic hardships, lack of medical access, violence, political unrest have forced many Venezuelans into leaving the country. The worsening social and economic political conditions of Venezuela have contributed to the rise of cardiovascular disease and have reinforced the need for better available treatment measures. A lack of resources has hindered the ability to provide much needed services. Felix Marin, president of Nuevo Esparta chapter of the Venezuelan Society of Cardiology, states that cardiovascular disease are the main causes of death not only in our country but also in the Western world. Primary interventions for cardiovascular disease encourage maintaining a healthy lifestyle by focusing on physical factors such as smoking, obesity, physical inactivity, poverty, lack of health care, unhealthy dietary habits, access to healthy foods, safe places to express physical activity, and individual behavioral choices. Secondary and tertiary interventions involve more targeted approaches for individuals with existing risk factors or conditions, like medications for high blood pressure or cholesterol, and targeted lifestyle modifications. In Venezuela, studies like EVE-SCAM have assessed cardiovascular health in the population, focusing on the American Heart Association's cardiovascular health score to categorize individuals and direct interventions. Risk factors for CVD are high in Venezuela. According to the World Health Organization, 63.4% of Venezuelans aged 15 or older are overweight or obese, and 31.4% are physically inactive. Additionally, 18.6% of Venezuelans aged 18 years or older have high blood pressure, and 9.5% have diabetes. Not only is CVD a major cause of death and disability in Venezuela, but it also contributes to the economic burden the country is facing. The cost of treating CVD is a serious financial burden for Venezuelans. The Venezuelan government has taken steps to address this problem, but there is still a need for more resources and investment in preventing and treating CVD. The government launched the National Plan for the Prevention of Control of Chronic Non-Communicable Diseases in 2009. This plan included initiatives to prevent CVD, such as public education programs and campaigns, school-based nutritional programs, increased safe access to physical facilities, and others. The government has also made progress in improving access to treatment for CVD. In 2013, the government launched the Cardiovascular Network, which provides free or low-cost cardiovascular care to patients throughout the country. The following organizations address and focus their efforts on combating CVD. They are the Venezuelan Society of Cardiology, Venezuelan Heart Society, Venezuelan Society of Hypertension, Venezuelan Foundation of Hypertension, Institute of Cardiovascular Studies of the University of Zulia, and the Western Central Cardiovascular Association. These organizations met in April of 2023 to address the problem of CVD in Venezuela. Economic sanctions have made it difficult for Venezuela to access essential medical supplies and equipment. Political instability has disrupted the healthcare system and made it difficult for people to access healthcare. Corruption has led to misallocation of resources and poor quality healthcare services. Cardiovascular disease is a major public health problem in Venezuela. The Venezuelan government has taken steps to address this problem, but more resources and investments are still needed to prevent and treat CVD. There is hope.